How comfortable, I suppose, do you feel, some of the nurses that you work with, how comfortable do they feel having those types of conversations with patients about things like erectile dysfunction and maybe low sex drive and things like that?
Sometimes it can be really difficult because you're trying to build up that rapport in a very, very short space of time, especially if they're having the surgery as an emergency, say, or they've woken up and kind of the stoma's there from some sort of traumatic event and things. It can be difficult to kind of get those barriers down really, really quickly and kind of build up that rapport in order to have those conversations.
Do you feel that nurses struggle to sort of build that rapport in a short space of time?
I think so. But I also think that experience, being experienced in the field of stoma care plays a huge part, because I've spoken to patients in the past where they've said, well, somebody told me that I could go about sex normally and I could just go and have sex. But in actual fact, she's informed me that no, she tried sex. It was really painful because nobody had told her about the change of anatomy internally. So I think what a nurse has to do before embarking on those conversations is be sure what that operation has involved, be sure what that anatomy inside is doing, both on the male and the female side. And then that gives you a bit of a heads up as to what problems they may come across. The libido side of things, well, maybe they don't need to have full-on sex straight away. Maybe they just need to hold hands and lie on the bed together, or just have that embrace. Maybe that's just what they need.
Yeah, I think that can work really well, can't it, for couples when they have maybe a strong foundation in their relationship. So, they then can go back to, the intimacy in terms of cuddling and kissing and spending quality time together. I suppose it's probably a bit more tricky for people that have maybe casual relationships, kind of like, how do they engage with new partners when sex isn't on offer? And I can imagine that's quite a tricky space for them to navigate.
Yeah. That's huge, and that is where I would say a lot of people will fall down. They will try and skirt around that, because I mean, so many patients have said to me, how am I meant to go out and get a date? How am I meant to sort of tell that somebody a new partner? And again, I think it's experience for me that's helped, because I've had ladies that have met new boyfriends. They've named the stoma, so Stella the stoma. It goes everywhere with me, and she's introduced people to Stella.